paid out for
Yeah,
it.
there you go. Okay.
So. So glad to see you. Been on my mind and I want to call you. No, not at all.
Actually, when my boss says that, I'm in trouble.
No, I was, you're like, oh, I want to come see how he's doing. It's been crazy with us. We had 3,800 pages to read through for our packet and for our hearing. And just,
Hello.
so I hasn't had a lot of free time to
Right.
catch up, but I'm so behind on the emails. I'm just trying to catch up. So thanks for being here. I tried to sit on this side of the room thinking that everybody would sit over there, so I wouldn't have my back to anybody.
No.
And you
There you
guys
go.
have already trying to outsmart most people. What's up?
Hey,
Not so far.
How are you? Good.
Those are plug-in, right? You should be.
Marshall.
I just told them, I'm so excited. I was here.
Yeah, I'm glad you're here. You're waiting for once in a while. I'm with you.
And my husband's like, well, they're working on it today. Are you gonna take it out this week? I'm like, I take part of tomorrow. I'm gonna be off. But not the whole thing. I was smart. Someone had a meeting, so I thought, oh, I should go where they're at. Like, well,
Went to
look
Atlanta.
at the parking lot here. I don't, let's see, I got some little time.
So. So this. So this
No, you
was
are
the
right.
same group, but They went through the blues.
We're busy.
Yeah. Yeah, and
It's huge.
I had to let go.
So,
My
my
assistant
system
manager go.
So, yeah.
Oh,
So I took on her responsibilities and mine, and now I'm working to rebuild the team.
oh, no.
So, it's at the worst time of the year to
Yeah.
try to rebuild the team.
Yeah.
Reframing things in a positive way.
Wow.
22%.
So you must be
increase. So
pulling-
those are the biggest.
Extra
Really
hours,
connecting.
you're doing 2 jobs or 3 jobs.
I don't know. We don't really ever see.
Roughly 110, 120
The effects in the first couple cohorts is the facilitators
Well,
gotta learn the ropes.
I hope you
But
find a
those
new
are
routine soon.
Unanticipated in a
Well,
very positive
it's
way.
actually coming together.
Number one
Last night,
intervention.
right before we closed, I stood back and I just kind of watched everybody.
The Blues program is
All right.
a single.
Maybe after 2 years, I could take a vacation.
It's a really about this kind of positive reframing.
Okay.
And
I hope you take some time.
Rethinking. So
we're gonna try.
You're gonna get some time this weekend?
Yeah.
Whoa, boy, look at the beautiful mountains.
Yeah, that's one of the major goals of that. So, and it also just gives the
All
young
his
people a chance
graduations,
to
nieces and nephews
talk
graduated.
about their feelings and things like
Yeah,
that.
that's-
Get on the trail and hike for as long as I want,
Yeah,
hike back if I want. Or just.
attributing at least part of
No
that
meetings,
to
no
the
schedules.
professional development
But
that
that's not
facilitators
good.
are doing
I can do it.
before they
At
implement. At Thompson, before they implement it, because, and like I said, it usually is the case that it takes a couple of tries at making the pancakes before the pancakes come out, right?
Yeah.
Right, but, yeah.
That's how my pancakes are. And was that, did you use the LMS?
So my daughter's.
Is that part of this for them?
She's getting
The-
her finals a couple
That's
weeks ago.
goal 2.
Right, so that's
Going out
separate,
and
that-
Was going to go forward on her.
that,
her,
they're not
pledge.
getting things out of the LMS.
Oh, yeah,
Not the
right,
youth, we are
she's-
creating some
No
for the
going
youth.
back.
Okay.
But
And
for some of
then we said, oh,
But for the
yeah, it's our fault,
programs that are-
you have a warranty, we should fix that better. But
So I'll
then they
make
can
sure I
no,
understand.
no, it's a whole.
Yeah,
So this is youth that are,
$5,600.
Youth are in the blues program.
Currently
Right.
$500.
Yeah.
I'm not putting $5,600
Facilitates
into it,
participants
so she's been
program.
going out of town.
It can, it
I don't know what
depends
we're
on
gonna
the
do,
school
can't
district,
afford-
but it's
can't
like,
afford it. I'm in a used car right now, so it's like.
school,
She gotta go to
mental health
school
support staff,
and work, and
or
so
nurses, or
She's been out of
whoever
town,
the
she sees
school
this
has
class, I'm like,
in charge.
okay, that's
That
what you've been gone, but
training,
we kind of did.
they
this,
get through. the
aggressive
as we
can.
Okay,
Yeah, so
Probably should,
where's
so.
Cougar?
Pooter is
Yeah,
a little bit
something
behind
happened
Thompson,
accident,
they're going to have their teachers do the LMS in the fall.
Can you fix it?
And then
I can
initiate
fix it,
the
but
program
I
in
don't
the
know if
fall.
it's worth it.
So that's where a lot of my
It's like a
carryover is
2,000
coming
mile
over
city.
year two is for that goal three.
300,000 miles.
So
It's not.
Well, they have professional.
You're gonna put into.
Right, yeah,
Are they gonna include them in this?
yes,
this is
that's my
unfortunate,
understanding.
so.
Yeah. Oh, okay.
Oh,
Yeah.
okay, I was just sitting there going. Wow. And then tomorrow with our Zoom, please highlight some of this.
Yeah, well,
Cause we're gonna have a pretty good group, and we'll have, what's the gentleman's name? Tyler?
Kent,
Kent.
Kent,
Kent will
Oh,
be
yeah.
on tomorrow as well.
Great.
So they'll learn about the program, I want to make sure the superintendents are all aware of that.
and we've had initial meetings with Rise Above and
Rise Above.
two of the three school districts, Booter or Thompson and Estes Park, to just go over everything and coordinate the work. And so we still have to meet with Booter on that.
Okay.
But we're already getting going on making sure that everything is as streamlined as possible.
So Liz will be on because Kingsley's not available, so that'll be the person that, good, all right,
Yeah.
good.
well, me used to run, you talk about no passports or something?
No, it's just, we meet quarterly with the superintendents.
We met with Elise Thompson today, we have a quarterly meeting with Bertha and Thompson. Loveland, and then we gave out that $2 million, looking matched it for the CTE.
That's awesome.
Expansion, but superintendent, she had been kind of fully. Forget that I was conversating. And then they didn't just for the thing for Tuesday, and so he felt really bad. But it was kind of like, is that a snub or did they just blow it up, what's going on? So,
Yeah, cause that's not like, kind of.
no, I know, we're like, what's going on?
Yeah.
Usually on the spot.
Yeah.
How many interns?
Sure, great. They had both in class.
Yeah. Well, it's funny because Anna walked in, she was orange, she was, we're in class together. So they didn't really know each other before. They will.
Yeah, I feel so fortunate that I
Yeah.
haven't had anybody.
Lord.
like,
Sienna came up to me, she was the one that said,
Like, move
she was
on,
like,
in
I wanted to.
a few years, and so I haven't had.
This is a good
All right,
start.
everybody.
Yeah, what are you doing?
But, I asked her.
Have you met Shannon before me?
Yeah, I believe you're very familiar, we haven't formally met, yeah, I've seen you around, yeah.
Shannon's her.
So color now, change it up.
Been picking up slack. Years.
Yeah.
The last month or so.
Yeah.
Thank
So we
you.
had a really great, well, I'll start town hall.
I'm Nate.
Had people
Yeah.
call,
Great.
and today, a person kept calling me up, I'm like, okay, I'll call him.
Incredible.
That's really important, and then she just called and like, that was the best call, I love it, so glad.
It's like,
Okay, because I was like,
Yeah.
someone's got a problem, but I'm like, hey, how is your problem, because. Keep calling you.
They had an
It's really
RFID,
amazing.
basically a
Oh,
cooperative.
I was expecting someone to
They
start
wanted
yelling
to
at me
use
about
that
something.
and like
I
data
was from
around,
lunch yesterday,
you know, where,
they don't know.
where is the data? So put data on where the data is.
Assessment.
I know.
Yes. And then
I was
map down
distracted, a lot
to
of little
where
dumpster
people's
fires were happening, but
organizations are in
but
the
it,
two
um,
counties.
yeah, I felt comfortable.
And
Great.
Does that help?
use those data to
Yeah,
inform.
Yeah.
Was yours comfortable? Cool.
In
Yeah,
El Paso.
I'm glad you did that, because that's important to me.
Yeah.
Got a good team of
I wanted to. you to feel
local
comfortable.
CTC, County Hotel,
Nice.
counties.
Cool,
and,
good vibes here.
um,
I'm glad you
Yeah,
did
so
that.
that's just getting started. Um, Think-
Letter to read.
The else probably.
To do something similar to what we're doing here.
Well, that's a big
And
piece.
the southeast.
Yeah, that you are.
Yeah.
To do similar
Because
stuff.
next week you start the cycle. Yep. Have we had any?
Interesting project, right? We've got some good energy around this stuff and hopefully we can do some good.
Cultural enrichment center. Have they ever
Like,
as encouraged, they're doing some mental health and peer support.
Okay.
They do things for youth of color.
I've seen it through like previously.
Yeah.
Years or things.
Yeah, they're doing emotional health and mental health. But also peer stuff, also doing like, they have computers and 3D printers and.
That's really
Yeah, it's kind of neat something. Strongly encourage them to reach out to you and she looked for something, they're nonprofit, so they're. That too.
I've seen 4 new organizations register already.
Oh, okay.
But usually what happens in June, and for the cycle week, I'll have one and then it'll be a lot more, the like there's just June.
Okay.
So, yeah, trustee.
Ah.
And there's.
Well, just heads up that I encourage you to do that, so.
Okay, so.
It's a great, likewise, you, Brian.
Yeah, I was very excited about that.
You love it.
So, yeah.
Do we have trustee, councilperson Black, trustee Glenn, trustee?
Mason.
All right, okay, good. Okay, welcome, everyone. This is the May Larimer Regional Opioid Abatement Council meeting. It's May 23rd, 2:02 p.m. Let's call the meeting to order. We do have a full quorum, is that correct, Liv? We've got 3 on Zoom and 3 in person, as well as our advisory members, technical advisory members. So let's get started. Moving on, do we have anybody that would like to make public comment? And you all can hear us online? I think we saw that. Okay, great.
Yeah, we can hear you.
Yes,
Thank you.
Yes, I
No.
can hear.
Thank you. Okay, not seeing or hearing any public comment, let's move to item number 3. Approval of April 25th, 2024 ROAC meeting minutes. I'll entertain a motion.
Also love.
There's a motion.
A second.
There's a second. Any further conversation? Okay, good. And those online, there, we see all 3 of you now. Great, perfect. Any more conversation? Seeing none? Anybody opposed that motion? Hearing none, that motion passes unanimously. And I just want to pause and thank Liv. She's taken over this responsibility, is doing a fantastic job with our minutes. And so you all aware, I review them as well as Beth reviews them, and Beth, they've been spot on. We hardly have to make any. So we really appreciate that. Thank you.
Excellent.
Excellent work. Okay, moving along to the fiscal grant administration. Under there is April finance report. I'll turn it over to Carol Block.
Yeah, the April report is in your packet, and we don't need to go over that in detail today, but I did want to point out that the ROAC has allocated all of its funds for this funding cycle. And as of today, we have made all of the first grant payments. So everybody has received the first half of their grant payments. So that's it for financial.
Any questions on the financial report? Thank you, Carol. We'll move to the CSU final report for the 2023 school-based prevention grant. Turn it over to Dr. Nathan Riggs. Okay.
Well, let me
Sure, please.
interject. The ROAC has said that they weren't looking for a verbal presentation.
Yeah,
They were just looking for a written presentation. So that's why our grantees are like, what?
I can summarize that.
Would the council like a summary? I have a couple, you answered my question. I have a couple highlights because I'm pretty impressed with the report. So what would the council prefer? Make a brief summary or just ask our questions?
I think since, I think it appears we have time in our agenda, I would love to have a highlight from Dr. Lake's discussion box there.
So everybody remembers there were 3 goals to this
You
project.
can probably come up so they can see on.
Yeah, sure.
Thank you, I appreciate it.
Yeah. So yeah, I guess if you remember, there were 3 goals for this project. The first was to, before we started implementing new programs, we wanted to make sure what was going on in these school districts related to prevention. So we created these prevention scans, identified all of the work that's being done, what work is evidence-based and what work is not evidence-based, recognizing that school districts are going to have a mix of evidence-based and non-evidence-based stuff that's going on in their school districts. We identified that there is definitely a need for evidence-based prevention programs for substance misuse and mental health promotion. And so all of that information is captured in the 6-month report because that was all completed in the first few months of the grant period. The nice thing, and just to reiterate about that, is that the school districts have been using those scans to plan strategically for their prevention efforts moving forward in the future. And then in the second goal of this project was, since there is most people who are implementing prevention programs haven't been formally trained to implement prevention programs. We wanted to create some professional development around prevention so that the facilitators can effectively implement these programs and maximize the impact. So we have been working on creating modules, professional development modules around prevention, uploading them onto our learning management system, and having the people in this first wave, the people who are going to be implementing these programs, take these professional development modules. The specifics are in the report as to how many folks have participated in them, completed them. They can get certificates of completion and then claim those for their professional development credits. And I think Thompson School District is really an early adopter of all of this. Estes Park has participated in these. As you can imagine, there's variation in school districts and these big systems and their ability to really kind of mobilize, and it's taken some of them longer than others. But the report goes through the very positive response to these professional development modules in terms of did I enjoy them? And I don't know that many people enjoy professional development, but it's showing up that they're actually enjoying the modules, that they would refer them to friends, that they would sign up for additional ones and such. So that's great. Those 2 goals are complete, and we'll continue to populate the professional development for year 2 so that the teachers can, or the facilitators can continue to learn. In year 1, it's very kind of basic, level 1 prevention, knowledge and awareness. In this coming year, we're going to amp up the professional development so that we can continue to make sure that these programs are being implemented as intended, and that if a facilitator needs to adapt a program, that they're doing it according to best practice and not just doing it kind of willy-nilly, because we know that I think it's 80% of all adaptations end up harming the program. So we want to make sure that if you're going to be adapting a program, you're doing it according to best practice. So that's the big piece on these the learning management system. Even though we've completed what our deliverables were on in that, we continue to populate it. And we have partners at Penn State that they're populating it as well. And so that's great. So if we move on to goal 3, that was really to then actually go out and implement programming. So these are the reports of satisfaction and that they enjoyed it and that they would continue to recommend it and things like that. So we have started implementing the Blues program in Thompson School District, and we've had a couple of early cohorts there. And what we're finding there, much I would say, to my surprise, are some really large effect sizes in program outcomes in these first two cohorts. And I say that much to my surprise because most of the time when we start to initiate the implementation of a prevention program, the facilitators are still getting their feet under them. They're still trying to figure out, how to do it correctly. But it appears that in Thompson School District, the students are really, really benefiting from the program. We have a table that shows the pre-test, post-test changes from before they started getting the program till right after they got the program. In that table, we have something called effect sizes from small, medium, large. In prevention, you generally get medium effect sizes. We're getting very large effect sizes even after this first couple of implementations. We have to put it in percentages, which is probably the most interpretable for folks. We've got 27% decreases in depression. We have 41% decreases in anxiety, 47% decreases in negative mood, and then 22% increases in something called positive restructuring, which is kind of, for lack of a better term, seeing the brighter side of things, right? And so we've been conducting some focus groups in another project on, and I know high concentrate cannabis is different from opioid use, but the main reason why young adults are telling us that they're using high concentrate cannabis is to cope with negative emotions. And so by decreasing these negative emotions, the idea is that we're going to then end up preventing substance misuse. Some of the school districts don't want us to ask students about substance misuse. Thompson School District is one of those. Other school districts are okay with it. Hooters, we're going to ask them questions about substance misuse, and so we'll be able to get an idea of that. So we're really excited about it's one of those things where you run the first couple of cohorts, you gather the data, you enter the data, you code the data, and then you hold your breath while you hit return on your stats program and hope that things turn out all right. And thankfully, in this case, it looks like we're doing the job that we want to do. So that was a really brief summary, just kind of off the top of my head. I'd be happy to answer any questions if there are.
Any questions?
I will say most of the carry forward into year two is on this goal 3. It just took school districts. We had a real aggressive time to go from starting systems change to implementing programs. Thompson was, like I said, a really early adopter. It's just taken Hooter and Estes a little bit longer to get going. They're going to roll everything out this fall. And so that carry forward will get spent on that in the fall.
Yes.
I noticed one of the things you said in your book, what could be better, what could be improved, was the timing of the fund disbursement and all that. Is that something that is something we can do now with this current year? I mean, is there something we can adjust to make that look better?
Yeah, I think that's more of just a challenge of working with schools in that we have to wait until the fall to spend that carry forward because there's that 3-month gap and there's nothing really we can do about it. We can think about if there are, but it's just the natural rhythms of working. Now, over the summer, we are working directly with the administrative folks in each of the 3 school districts because they're 12-month, well, I think 11 or 12-month positions. And so we'll be able to continue to work with them over the summer on really rolling out the year 2 plan, as well as continuing to carry forward on the Solution program in year 2.
Trustee Youngland, I see your hand up.
Thank you, Chair. Although the numbers are low as far as, not pleased or not good end results, are you checking back with them to see what it is that they may not have liked or how we can, even though they're small and it's exciting to see such great numbers higher, but how are you addressing these small few that are not liking it, are displeased, don't think it's that effective, etc.?
That's a great question. And in terms of kind of continuous quality improvement of the learning management system and modules, it would be good to circle back with those folks. The school districts have been, are very protective around identifying not only students, but also the teachers who are completing the responses on the learning management system. So it's hard to go back in retrospect and ask them. One of the things that we could potentially do is have a drop down in our response format is if you didn't enjoy it, or if you somewhat didn't enjoy it or really didn't enjoy it, there's a drop down that says, please explain why. And if there are common themes, then we could go back and try to address that. Yeah, that's a great question. Thank you.
Thank you for all the work, and it's really exciting to see the results. And I was kind of curious, I see some grad assistants and some students working with you on this, and you know, workforce development and workforce pipeline for these areas is really important. And I'm wondering if this work, how they thought about this work, and if that spurred them to consider different pathways or others. Is this kind of in spiking interest for others? Just curious about that.
So on our staff, is that?
Yeah.
Yeah, so we have some graduate research assistants that are working on these projects, and they're master's students in prevention science. And there are maybe 8 to 10 master's programs in prevention science around the entire country, and therefore the world, right? And it's really kind of a drop in the bucket in terms of prevention's workforce. But they are folks that are really invested in this translational research to communities process and have done an amazing job. And they're the ones who are doing a lot of the work in the creating of the learning management system modules. And they're getting not only a great education in prevention science and prevention practice, but they're also directly engaging with our school district personnel and learning how to engage with community partners. And in fact, I'm ending up hiring a couple of them to the Prevention Research Center because they are doing such great work. I feel a little bit bad because they're not going out into the community and then translating their expertise in the community. But yeah, it's definitely been something that they feel really passionate about. And it's an opportunity where they can actually take the science that they're learning and use it to engage with communities around evidence-based and best practices and things like that.
So maybe just another side benefit from all of this, just curious about that.
Yeah.
Thanks.
It's true. Councilmember Black.
Thank you, Mr. Chair. Appreciate it. I really appreciate this program and am looking forward to the results later and later. So I noticed with belonging that there wasn't much of a shift before pre and post survey for that. And I'm just wondering, does this program, can you make adjustments based upon that information to somehow address that, put some attention on the belonging piece?
Yes, so we're constantly taking the evaluation data that we get and we feed it back to the school districts and then ultimately to the facilitators, so that they can use that information for the next iteration or the next cohort of implementation. And so those are skills that the facilitators that we're trying to install or instill into the facilitators to take that information and then feed it back. We see evaluation as not a linear pre to post and then we're done. We see it as a cyclical process through which we continuously improve the implementation of the program. And so that's the answer to that question.
So you guys will be looking at that, but are you telling me that's depends on the facilitator and the group they're working with, whether that deem that appropriate, Or is that an automatic thing that happens when you get numbers like that post program?
Yeah, so what we can do, or what we do, is we then talk with the school districts and say, hey, what we call mediator is we're really doing a good job of moving the dial on this, but this isn't really getting the dial moved on. So maybe you can beef up the school connectedness piece of the Blues program. And it may just be that there were, these are the first two cohorts, and, we'll see what happens as, the teachers or the facilitators continue to learn and become more skilled at implementing the program.
Sure.
But yeah, we can absolutely use the data to improve program delivery.
Fantastic. Thank you so much. I appreciate you.
Yep.
Fine. Well, I'm impressed and appreciate the work. I'm looking forward to more information as we go into year two. Good, thank you.
Thank you.
All right, moving along. That was great. We now got our Limerick County Sheriff's Office grant final report. How would the council like that? Is give I see Sergeant Cook here. Would you like a quick, brief synopsis of this, or just ask questions?
Would love that if you said for it.
Oh, my apologies. We do have an action. I'm gonna, thank you.
Yeah.
I move that we accept the CSU, Dr. Lake's final report as submitted.
Thank you.
Second.
There's a motion and a second. Any further conversation? Seeing none. Anybody opposed? Hearing none, that passes unanimously, and thank you as I move right along. All right, sorry. My apologies.
No problem at all. Thanks, Mr. Chair, members of the council. Our goals really with last year were really to expand our co-responder unit. And I think obviously with the assistance of the grant money from the Regional Opioid Abatement Council, we were able to partly do that. We were able to add the 2 new deputy positions, and then also a corporal position, which is like an assistant supervisor. So we were able to expand those positions, and then with other funding from Limerick County Behavioral Health Services and other grants, we were actually able to add that additional clinician and a clinician supervisor. So all told, we were able to pretty much double. I shouldn't say double, but we were able to expand our service hours. Originally, our service hours for our co-responder unit were from 10 in the morning until 6 at night. And with the expansion, we were able to come in earlier and start at 8 o'clock in the morning. And then we have coverage 7 days a week until midnight. And what we've noticed is that obviously, originally we were looking at the most busiest times when we start our unit. But since we added the additional positions during the afternoon and evening hours, we've noticed that there's been an increase in those positions being utilized quite a lot, actually. So we've been able to contact more people. We've been able to increase the amount of contacts that our unit has made, and the amount of calls that our unit has been able to handle versus the rest of our patrol section. So what in essence has happened is that because of our expansion and because of the ability to expand with the grant funding, we've been able to funnel those calls and those contacts to our co-responder unit and kind of take it away from the general patrol section having to deal with those issues. And thereby, I think, provided a higher level of service and a more effective level of service, because our co-responder units have been and are trained to deal with some of those complex issues involving mental health, substance use, and co-occurring conditions. I think that kind of sums it up, unless you guys had any other questions specifically. Yes, Commissioner.
I'm really thankful. First, let me thank you and your teams for coming up to my Estes Park talking. The hospital board members and the other folks who are, all these different groups that are children, people were so impressed. And it was.
I couldn't be there at that one, but I heard that.
By a coffee and pro responders and love it. So come, But you also, above what I think personally, went above and beyond by getting that Connect Effect posters out and, into the schools and helping do a little education with that and awareness. So first, that's my first question. I have a second one to follow. Can you tell me how that was received and how that looked? And then I know you applied to, we kind of gave permission for you to apply for that $1,500. Since you were doing that work, that was an incentive for the rest of the regions to do what you had done.
Sure.
And so I'm glad we got that for you, but I'm wondering, how do you think that helped? Or did that kind of raise some awareness? And I've got my little sticker here, so.
So yeah, the Connect Effect program, and thanks to you, actually, Commissioner, for bringing it to our attention. Because I think part of the State Attorney General's office approach with that Connect Effect program was basically just getting the word out that it exists and that it's useful for kids and parents, as well as school administrators and staff. But what we were able to do when we realized that program existed and that it really was a program that was pretty well put together, well designed, it had kind of two focuses: one for parents to deal with issues that they saw with their kids, but also for the kids to deal with issues as peers of other students, and to kind of have that peer education process so that they're able to increase their awareness. So by putting those posters up, as soon as we heard about that program and I was able to kind of look at it and ask questions about it, I realized that program is a really effective program, and it really needed to be basically to have its awareness increased throughout the state. So we've also had discussions with our state Association of School Resource Officers about this program. And I think the Attorney General's office is actually working with CASRO, which is the Colorado Association of School Resource Officers, to try to get some more training and exposure in all the schools through all the SROs kind of as a result. So that was very effective in getting the awareness increased. I couldn't really tell you what kind of effect it had on the students per se, because we're not part of that end user process. But I'm hopeful that just getting those posters up kind of increased the awareness for the kids in the schools to see those posters and look at that as a potential resource that they can go online. They don't need to talk to anybody specifically, but they can learn about the dangers of prescription drugs and fentanyl and opiates without actually having to feel like they're ratting on somebody, but at the same time feeling empowered to kind of take care of like their friends who may be suffering from those addictions and those situations, which other kids are involved in that. So that peer-to-peer process seems to be very, very effective. Even on the mental health side, we're seeing that the kids are most responsive to their peers. And if we can get and increase peer awareness of that program and also of just mental health and taking care of each other, I think that there's a lot of power in that. And so we're really trying to work with, as you mentioned, Commissioner, the Coffee with the Co-Responders. Part of the grant request for next year was to include some funds so we can do more of those at the high schools, which we plan to do. And we have done a couple of those already. Unfortunately, we couldn't get any in the last month of the school year because it's so busy with the kids taking tests and other commitments. But that is part of our strategy moving forward is trying to have those meetings and then bringing those peers in from different programs that the school districts have that really kind of help the kids connect with each other and then really kind of teach each other with some facilitation from our co-responder units and our SROs.
I appreciate you answered that. And I know we have other hands, so I'll just rephrase my next question. It's congratulations. I heard from the superintendent of Thompson School District that the pilot program of the school-based response team has gone so well. I thought they were just doubling, but it sounds like they're tripling the team. And so job well done. And it sounds like it's been very effective. And I think just looking at these hours and knowing how much time it's spending to do responding to this and helping folks get into services and just how much more time you're spending per, and following up. I just want to say I think it's been great and well done. And I know you're doing a lot of work across the state and the country. And it sounds like a lot of people are now coming and asking, how are you doing this and wanting some more work. So I just want to let you know, I just commend you all and thank you and just let me know separate from this how I can be supportive. So thank you.
Absolutely. And thanks again to the council for your support, both last year and this year. We really appreciate that, and we'll really use those funds to continue to make an impact.
Trustee Youngman.
Thank you, Mr. Chair. You guys have done great work and I really appreciate all the efforts, and continue efforts. My question, for really everything that we fund is down the road and how that looks at sustainability of this project, bringing on, your increased co-responders. The opioid money obviously is going to be running out at some point. And I would just like to see some thought when you do your reports, not, maybe currently, but, what's your thoughts of keeping the sustainability of the programs that through the funds you're gaining, but how do we keep them going and what you guys are doing looking ahead? So that's just something I would like to know, how you're looking forward.
Yeah, good question, Trustee Youngman. Thank you. That obviously is something that we've thought a lot about, and we realize that there's beginning to be a lot more competition for these funds because more people are knowing about it and learning about it. And I think there's so many more things aside from what the council's already done that these funds can go farther and longer to different programs. So we've already kind of started the process of with our command staff and the sheriff about transitioning from the grant funding through ROAC and other sources to just making these new positions as part of our expansion permanent positions, and asking, planning on asking for support from the Board of County Commissioners to consider those positions in the next year or the following year to be proposals for employees that potentially could be partially or fully funded by the Board of County Commissioners. So that's something that you'll probably be seeing, Commissioner, coming up maybe in the next service proposal. But I think we all realize that having grant funds tied to positions is not the best way to fund positions. And I think this process has allowed us to realize that we definitely needed that expansion and that we're using those funds efficiently to make sure that this program would be successful. And now that it continues to be successful, I think the next step is maybe trying to transition. So we are thinking about that, and we're actually kind of moving forward with that process. And hopefully that answers your question.
Okay, thank you so much and great job.
Thank you.
Aaron Black.
Thank you, Mr. Chair. Thank you so much for this thorough report and all of your statements. If I could have us look at page 36 of our packet, those are showing the graphs of the youth crisis response team. Thank you. The pie chart that shows our 3 levels of school, and we're not quite a third there. Elementary is a little less, but you know what I'm curious about? The call type by each grade level. So high school, the call types for high school, the call types for elementary school, because I'm really curious to see if there's much of a difference or not between the elementary, middle school, and high school levels.
Yeah, I think that's a good question. When we designed our reporting tool, which has really been pretty innovative, and I give a lot of credit to Jeff at Fort Collins Police Department for helping us design a reporting tool for our SROs that was connected to a dashboard like what you're seeing here. And what we're able to do is replicate what he was able to do for the Fort Collins Police Department SRO program. And what we did is we replicated that and created the co-responder reporting tool and dashboard There's a lot of categories that we're collecting information on. One thing that we didn't necessarily think about was specific to your question, Ms. Black, was the types of incidents per the type of school. That's something that we can easily make an adjustment in, and I think we can certainly add that criteria that we can start collecting that information. But currently,
Yeah, okay.
we don't
Well,
have a way to display it.
I would greatly appreciate that. And I think that actually will be helpful as we go on when you're talking about expanding programs, doing more peer-to-peer programming. I mean, are they having as much suicidal ideation as our high schoolers say? I'm just really.
And I think that's a good point. I can tell you anecdotally that we've seen a huge increase in elementary school students expressing suicidal ideation and actually making suicidal threats and actually having a plan to carry out that suicide, which is very tragic, I think, and it's a sad statement on our society when younger people that are in elementary school are thinking about ending their lives. So I think that tells us how acute kind of that mental health crisis is in our schools, and it really kind of reinforces the need for more programs like our youth crisis response team. And as Commissioner Chad McNally said, we've already expanded it by adding another team. And I think the school district in Thompson is actually considering a third team now, just because
they are busy.
Those teams are very busy, and
they are.
And they aren't just going to calls where there's a kid that's misbehaving. These are like crisis calls where kids are in crisis either due to, substance use, mental health, serious mental health concerns, or that combination of both. And then along with just being kids in today's society. So there's a lot of evidence to show that, unfortunately, especially the suicidal part and even the substance use part is really starting to be pervasive in our elementary schools, where for the last probably 15 to 20 years, it's been high schools and middle schools, but now we're seeing that kind of really pervade those elementary school students too, which is very sad. I think it's a warning sign for us that we really need to double our efforts to address those concerns.
100%. Thank you so much. I didn't want to spend too much of everybody's time on that, but I have one more question. So how many holds? So we don't have holds by grade level either.
No, we don't.
I'm not sure how many holds came out of the elementary school, because my question after that is, did we have the bed space locally for those kiddos if they were?
And I can tell you that that's also been a huge concern over the past couple of years. There's been an extreme lack of bed space for juveniles, and that's why I think everybody in Larimer County was pretty excited about the grant that Larimer County applied for to start the process of building the juvenile center here on the Longview campus. And I think we're all kind of disappointed, but I think that effort should remain a priority for us to start that, because in many cases over the last few years where we have had juveniles that are on holds that needed additional treatment, we've had to send them to Wyoming, we've had to send them to Southern Colorado, we've had to send them to Montana and Illinois, just for a few examples that I know of personally. So the lack of bed space for juveniles has been a critical issue, and I think it'll be continued to be a problem unless we really start investing in trying to build more space for that.
I 100% agree, and I'm in support of that. Thank you so much. Thank
You're
you.
welcome. Thank you.
So I just want to, and I agree about all this information. I just want to remind us all as a council that really the grant that we gave them just only applies to not this youth crisis team, the other one. I just think that it's great you included this data, because I know you're just doing that as helpful for us to learn what else that
Yes.
is growing in other sites. So I want to make sure we're not holding the your team accountable for some of this data, because it's great to have it. But I think it's also for us to show the need is there. But we make sure that the other data is what the grant's applying for. And I'm just thinking this is great data for us to keep an eye on, because I think this is also, I think I had said, hey, this is great to show what you're doing on top of all of it, because you have been helping implement this, is that you're doing a lot of prevention work by this. And this is really important work. And I think that's kind of why it's great to know this. But I want to make sure we remind ourselves that really they doubled that and there's other data, but this is kind of above and beyond what
Sure.
your grant was, but this is important information. And I think this is certainly, and I know Laura Walker's on there, but I am bound and determined that we are going to have this phase 2 of adolescent focus, and we're assessing that. It's on the master plan, but we're trying to figure out, and if we had gotten that grant, we would have, but it isn't, but this maybe gives us some time to think about what's really needed here. So I just want to say fantastic job, and please join us all on June 1st for coffee with Certificate and others in the Foundry in
Level.
downtown Boulder.
Thank you very much.
See, Gordon has one question, and then we're gonna need to move on in the spirit of time, so Gordon.
I'll be quick.
Good.
Thank you. I was looking at the disposition graph here from the co-responder team and wondering if you had similar data for the non-mental, the normal patrol mental health calls, because I was wondering, do those dispositions look different? Are there fewer people going to jail? Are there more referrals to Longview or whatever else the metrics may be when that non-trained unit is responding?
So that's a good question. Our data collection system is only implemented within our co-responder unit. So we're not able to necessarily break it down to that level with the other patrol calls. But I can tell you that we do yearly training with our patrol staff about co-response. And so we really do really focus on the three really goals of co-response, and that's to keep people out of jail if the issue is really mental health. It's really to kind of triage, and so this person has a mental health issue and an illness. This person needs services, even though they may have committed a minor crime. This is really in triaging that. This is really what they need, and then keeping those people out of jail. And then also keeping people out of the emergency department if we can do safety plans so that it's not costing excessive amounts of money to do all the medical testing that we have to do at a hospital when somebody comes in, when it's just a mental health issue. And I think Longview has really helped in that regard, and we're able to kind of skip the hospital and come directly here.
Patrol units can't still, right?
They are not able to bring people directly, or just the co-responder units so far. And then, of course, the people that walk in on their own. And then the third goal really is to try to identify those people who may be community, maybe on the threat assessment scale of maybe being a danger to the community, and try to identify those people and get them off the pathway to violence so that we can get them focused on mental health treatment and substance use treatment, so that they don't become a danger to the community. So we do that training with our patrol staff, and I think they're all pretty in tune with what we do. Of course, they're not going to have the same level of training that our co-responders take. I can tell you that it's probably going to be similar, but I don't have the data to actually show that because our regular patrol units don't use this reporting tool. And data is something that Commissioner Shattuck McNally, along with Emily Humphreys over at Criminal Justice Services, and actually Larimer County IT and the Sheriff's Office and all the agencies in Larimer County are really working towards coming up with a very substantial and countywide data tool so that we can incorporate all this data into one system and compare apples to apples and oranges to oranges. And then by that time, hopefully, we're going to be able to include that other patrol element of what we're doing, the work we're doing.
And just so I understand the graph, so those 1,000 whatever calls that, not the graph table, that the patrol section responded to, that's because either the co-responders were otherwise engaged, or was those off hours times that aren't covered still?
So some of it's off hour times from midnight until 8 a.m. And then others would be when the co-responder unit is busy on another call.
Thank you.
You're very well.
Wonderful. We do have an action item.
I believe that we accept this final report as written by Sergeant Cook and Larimer County Sheriff's Office Co-Responder Program.
We have a motion and a second by Beth. Any further discussion? Seeing anybody oppose? Hearing or seeing, that passes unanimously. We'll move on to summary of grants. Carol?
I wanted to bring this to the group today so that you could see how you've allocated your spending and what you've done with it. And then also have that as a framework when you think about the next cycle, which the group will be planning for pretty soon. So the council over the 2 years cycle has 5.5 million, has allocated 5.5 million. And even though we plan a year at a time, it gets added together when we report to the AG's office. So this represents what happened over these 2 years, 23 and 24. And as you can see, you as a council picked 6 buckets to put your funds into. And these buckets are supposed to tie to what is known as Exhibit E, which is the list of approved uses. So we have 6 buckets: social connections, harm reduction, school-based programs, care coordination, housing, criminal justice persons, and then in addition, there's the admin bucket. So next one. Okay, so the social connections, you allocated 11% to that, and you divided that into 3 grants. And all of these grants were just for 2024. And that's the Yarrow Collective, which is staffing and services to host social connectedness events. The Denver Rescue Mission to increase intake, case management, and community life coordination. And then the Abundance Foundation, which is funding for 2 recovery coaches and social and learning programs for clients at their sober living houses. The next area is harm reduction, and this was a 2-year grant. You gave the grant to Colorado Health Network in 23, and then you approved an extension in 24. And they had 4 objectives: reduce and prevent drug overdose by providing Narcan, increase access to harm reduction supplies and services, increase client linkages to addiction care, and reduce infectious disease transmissions from the reuse of supplies. So the next area the ROAC selected was school-based programs, and there are 2 grants in this space. The first one is the CSU grant that you heard from Nate about, and that was a 2-year grant. And then the Rise Above was a new grantee, which you approved just recently. And that is an awareness campaign targeted to Larimer County youth ages 12 to 17. And I think Rise Above and CSU are coordinating their efforts. The next area is care coordination, evaluation, stigma reduction, and education. It's this big group of needs. And this is where the majority of the funding went. And this grant was to North Colorado Health Alliance. And again, it's a 2-year grant. And you can see there are 4 areas, and the major funding went to care coordination. And then there was community-wide stigma reduction events and information, evaluation and community-wide data development with the Butler Institute, and then providing education, including Rethinking Addiction and Recovery Conference. So next is supportive housing. And this was an area that the ROAC chose to fund just starting in 2024. And there are 2 grants under this area. The Abundance Foundation is providing sober living housing scholarships in both Fort Collins and Loveland. And then Denver Rescue is expanding their facilities by 8 beds by renovating an existing space and adding septic system capacity. Then our next area is the criminal and justice involved persons. And again, this was a 2-year grant, and you heard about that just a few minutes ago. So that brings you to your totals by grantees. And I'm afraid it looks like when this slide was formatted for PDFs, it kind of messed up the numbering, so I apologize for that. But you can kind of see that Larimer County received a fairly significant piece, North Colorado Health Alliance. And then you can kind of just see by color which grantees received which amounts. And then that leaves the last chunk, which was administration. And what this group is using administration for is meeting coordination, grant administration, and the fiscal agent. So that's primarily Larimer County staff that are providing support. Also data and technical expertise, and conference sponsorships and attendance. And then we've also done a couple of lived experience stipends for our advisory members. In addition to the sort of operating grants, this group also funded some capital investment grants. And that included 3 vehicles for the sheriff's office. And then for Harvest Farms, the 34,000 facility expansion and 50,000 for septic and other building code updates. So that's sort of in a nutshell how you've been spending your time and your resources over the last couple of years.
Yes.
So if we could go back to the slide, with the new slide, that one. So those are the buckets, but when I think about that title of criminal justice involved persons, that's not what the co-responder unit is, because most of those people on those calls are not criminally involved. And so I don't know, I feel like that's kind of not telling an accurate story, and I'm wondering if we should rename that bucket or have a separate subcategory, because I feel like when these folks are being engaged with, not all of them are criminally involved in the justice system. A lot of them are just people in crisis. So to me, when I think about the public, I don't know if that's accurately telling that story, and I'm just wondering if we should maybe rename that piece.
Well, we actually, as the region, don't have any say over the names of those buckets. Those are buckets that are given in that appendix E, and we have to pick a bucket and put our funds in. And the buckets the titles aren't great. And this particular one, I think, has some subcategories or sub-descriptions under that big bucket, and some of those fit a little bit better, but we're having to just take our ideas and put them in those assigned pots.
So I'm wondering if, and I appreciate that, and I was trying to remember, I thought maybe it was the case that, those are the buckets, and I'll make a little sign comment on that in a second, but I feel like if we could somehow add something, just for the public that are looking at this, so they understand that this is, because it says co-responder for 2 years, but to kind of really call this out, that this is for this co-responder to respond to folks who are in crisis, but are maybe not involved in the criminal justice system. I just feel like we have to kind of, because if there's some of the public who are not informed and they look at this, they're going to wondering what this is. The reason I ask this is, the Attorney General put on a post the other day because he's really excited. We're getting a lot of looky-loos from across the state, and I know Sergeant Cook is getting requests from around the country and the state for his program, for the co-responder program, and John Oliver did a national report, and it held up Colorado and one other state. I don't care about the other state, but they're holding as they were the gold standard. Only 2 states for the opioid abatement money, and it's very critical of how other states have just put all their money and dumped it completely, no transparency, just dumped them into their general funds or for police departments or other things. And I don't want, I feel like if we're careful about telling that story, since we are getting more scrutiny, to make sure people know this isn't just putting more officers and cars on the road, but it's actually a program and tools. And so I don't know how we do that, but I really want, because this is public facing and I feel like we need to tell an accurate story. And maybe I'm pushing on this, but I saw that and I was like, well, we're not doing that, we're doing this. And so I just don't want it to be that negative. You know, because he was really hammering hard on the states and just dumped it into, and says, you're not supposed to be doing it this way. And it was interesting. We were mentioned at the very end, but I just wondering what you all think. I just feel like we have to be a little more, I think these are great slides and I think it's really telling a great story, but I'm wondering if we need to tweak this just a little bit. I'll kind of expand that just a little.
Yeah, can I address that a little bit? You know, the purpose of this little group of slides was really to inform you as to what you've done and to tie it to what the AG's office requires as far as those buckets. This wasn't really meant as an external reporting piece. And I think if you need something like that, which you probably do, you probably need to engage somebody that does that sort of thing,
Okay.
you know, to make a very nice sort of a report.
No, I think that's great. And I appreciate you talking. I wasn't sure if this was gonna be external. But if it is, I think we should be cautious about that. But I do think this has been very helpful. When you first said this to me, it was just great to see it all on one visual. And so I do appreciate all that you put in there. But when I woke up in the middle of the night last night and I don't know why this popped in my head. And I was like, probably because I saw the Watch That John Oliver thing. And I was like, that's not what we're doing. We need to make sure we word that right. So I need to learn to turn my brain off. But I feel like if this is just internal, that's great. And we can probably engage that. I mean, I'm sure your staff or Art, someone else can kind of do on that. But I want to thank you, Carol, because I know you kind of put this together and I think it's been helpful for us as well. So thank you.
Trustee Black, I see you have your hand up.
Thank you. I appreciate that. I echo what Commissioner Shattuck McNally said. I'd rather see that somehow say acute or crisis within criminal justice. I've had a lot of people in the community comment, I don't want our monies just going to the cops. Although I understand the co-responder program, I understand why the funding got allocated that way. It is optics. And so I understand Commissioner Shattuck McNally's comment there. I will say I loved having this. So thank you, thank you, thank you. I love seeing how we've decided these buckets were going to be allocated in the percentages. And this does help for future thinking on how to allocate future funding. So I really appreciate it. Thank you very much.
Thank you, Carol.
Thank you. Yeah, Carol, this is wonderful. It actually gives us much a better visual, that pie chart. And hats off to the council, everybody involved to really look at this holistically, thoroughly, looking at the data and picking these 6 areas that we know through that continuum is so important. So excellent. We absolutely can look at if we put together like an annual report or something, we will absolutely look at your comments on that.
If I might, Mr. Chair.
Sure.
Carol, I think again, thank you for doing this, but I also think I go back to that visual you created on page, I don't know where it is, the first one with the pie chart. I don't know how the council feels, but I still have the criminal justice involved, but and how we can change that. But I think that's great to have some of these on, and we'll talk about that with the data, but I think something like this also shows on the website and just kind of shows, because what struck me is, wow, we kind of really spread this out into lots of areas. It wasn't, one area heavily. And so I hadn't thought about it that way. So actually seeing it kind of made me feel a little more, validated, reassured that, we're trying to make sure we're doing these in lots of, the appropriate ways. And then of course, administrative costs only being 10% is a cool thing to see too. So that's just my thought.
Okay. I am going to move us on because we have about 35-40 minutes worth of material and only 30 minutes. So I want to really make sure we get us out on time. Our next item is bridging dinner sponsorship. Commissioner Carol and I were asked to jump on a Zoom with Jamie Field and Jack Patterson from AG's office What they would like to do is they're calling it the Leadership Awards Dinner. That's the night of the big statewide COAC council. And the day before MJ's, the team's Rethinking Addiction day long. So we got those 2 days going on, the 30th and the 1st. What they'd like to do is a dinner that evening, kind of bridging the two events. And not just have food, but have some awards and some things like that to just bring everybody. Bless you. So they're looking at us to provide a sponsorship. And you see there's three levels, 3,000, 5,000, 7,000 to help support this effort. As Carol said, that comes out of that admin bucket.
Yeah.
And we do have funding in there. So open it up for conversation. Yes, ma'am.
I'm trying to remember what we talked about, how many, because there's only, I think they've been talking with me because of, it's kind of, us going to that statewide conference and we encouraged them to come up. How many spaces there are, and I don't remember who all can come to this is for the conference, how many people can come from the conference from the council? And since it is locally, we might have more interest, and I'm trying to figure out, I think they were gonna try to hold so many seats from us if they were gonna be a sponsor. But I don't remember how many seats they were gonna have for the dinner or how for the conference, so I'm trying to remember if how that looks for us, if people want to come to the conference and that dinner, how many that is and what we get for that, or if that is. But I think it's supposed to be free, correct, the dinner for everyone?
That was my understanding, yes. If they can get enough sponsors, they are going to the Weld County, Rock, I can't remember what region number they are. They're gonna ask them for the sponsorship. Three, you're probably right. So they were looking at enough sponsorship to cover the cost of this.
And I'll just add that Lamar County Board of County Commissioners, I requested that we do a little extra sponsorship, so we have approved $1,500.
I'm sorry, how much?
$1,500.
1,500, okay, great.
And it is through our facility, and we are charging a nonprofit or government rate, so they're getting a little bit of a discount, but still it costs to do this thing, so.
Yes, ma'am.
I think it makes sense for us to sponsor at some level, and I also remember last year we also helped sponsor the Rethinking Addiction event as well, and wondering if we're also considering sponsoring that again at some level.
I knew that they were gonna ask you, so I wasn't going to.
Okay, so I guess that's the question of
What did you give to the Rethinking Addiction last year?
Now, isn't that also
Yeah, so you have contributed through the grant as well.
Yeah. It would be 15,000.
about 15,000?
Okay. So, I mean, I'm not 100% sure what we get for the different levels. And I think the idea is to cover the expenses of the dinner so that everyone who attends can have dinner and be there.
And awards, yeah.
Well, especially if we're envisioning a lot of us attending, since it's local,
Right.
it might be nice to give more than we would if it was in Montrose.
So we had, and I know that, the city, and some of the folks and Montrose, the food trucks, but they want to do that different. So we had, in our conversation with them, we had said, we were talking forward and they weren't sure how they were gonna come back because they were slowly building this for them. So I was thinking 5 was a decent number. And I don't know how everyone feels about that. So.
I was thinking 5 too, that, to Gordon's point, I think it's local, I think that's what they need, to be able to hold us.
And I guess we have to pay through someone else's, because the state attorney general's office doesn't want to be processing that or paperwork or something, so someone else is gonna be we pay through, kind of like we paid through you all. I think he just had sent that to us. I wasn't sure who it was, but anyway, just.
Yes, ma'am.
I just wanted to mention on the phone call, I got the impression that they were hoping that the larger regions would fund the higher dollar amounts, because some of the regions are pretty small that they're trying to get sponsorships from.
Yeah, thank you for that. I do believe they did say that. You're right. So I have a motion on this and for further conversation.
I
think, the only thing I was gonna add is it feels like we have quite a bit of money in our admin bucket, and it seems like this is a really good thing for us to sponsor and to give toward. It's a great learning experience for all the different, so I would actually be supportive of the 7,000, but I can go with 5.
And I would like to make sure, because I do think it's a bridging dinner and we've really been stressing the peer-to-peer model. And I would like to make sure that our folks who are helping inform our lived experience folks who have been so valuable, I want to make sure they know we want them there and they're a part of this. And so I want to make sure that they're a part of the dinner. So I want to make sure that Marshall and Christina and Shane are part of that. So I just want to make sure it's the council, but also want to make sure that they're invited as well.
Trustee Youngland.
Yes, I'm not sure who just spoke as far as saying the 7,000. I agree, there are a lot of smaller regions that aren't able to swing the higher amount. And I think Larimer County, being the size of it is, as it is, and lived experience people that we want to have come and things like that, I would be in agreement with the 7,000 as well.
Okay, Aaron.
Hi, thank you. I would be in favor and support of either the 5 or 7,000.
We're asking well too, maybe we can put some pressure on them to match for maybe 7 or 5, whatever you all vote on, for them to pony up as well.
Sure. Anybody want to make a motion?
I'll make that motion. It sounds like 7, so I think all are. And yeah, and it sounds like 7's the consensus, so I'll make that motion for 7.
Motion for 7,000, is there a second?
Second.
We got a second. Oh. Any further conversation? Hearing none, let's just do a full vote on this one. All those in favor of the motion to sponsor $7,000, signal by aye, please.
Aye.
Aye.
Anybody opposed? That passes unanimously. Thank you. All
Mr.
right.
Chair, just real quick, I know, don't want to stop it, but our attorney, David A. Rhodes, that was on screen raising his hand, and just wanted to say real quick that Carol's correct about for reporting purposes, that's what we have to say. And the category within the state MOUs, that needs to be addressed with changing that, some of that, but this is something for any public facing reports we could clarify for the public, so.
Wonderful. Thank you, David. Appreciate that. All right, moving along, we've got our Larimer Epi Data Working Group that we discussed at the last meeting. I will turn that over to Dr. Jared Olson. He works for our team of Health and Environment. He's got some population indicators to provide. So Jared.
Great, thank you. Thank you so much, Tom. Thank you, board. My name is Jared Olson. As Tom mentioned, I'm a senior population epidemiologist for the health department. We had our first meeting of the Larimer Epidemiology Working Group earlier this month, alongside the Butler Institute, who is facilitating that group. And we had a good structuring event and some good takeaways for next steps. So I think with that, I'll go ahead and switch to the first slide. So one of the discussions we had was some of the data we wanted to display from a population indicators. So we took some preliminary work and graphs that we had and discussed it amongst the group. There was a request and support for the idea of housing a couple of key indicators or key visuals on the ROAC website specifically, as well as housing the rest of the data across that kind of prevention, recovery, and harm reduction areas on the health and well-being dashboard alongside mental health. So the first one we've kind of pulled together for a key indicator or a possible key indicator is this. This is the accidental drug overdose deaths with fentanyl. This is the rate, so it's a population rate per 100,000 persons by year for Colorado and Larimer County. You can see a parallel here with the spike in the late teens. And then in 22, as Colorado is flat with their rate around 16, we dropped to about 10. And then I have some preliminary numbers here for 2023. So these haven't been released from CDPHE yet, but CDPHE has released their total number of overdoses with fentanyl to some news organizations, Fox 31 in a report. So I can kind of estimate what that will be, as well as for some preliminary data from our coroner's office to make that estimate. So you can see a change, a divergence here. One trend that we're hopeful to continue as we move forward in the next couple of years. Next one here. So kind of looking at some of the things that are changing within our county, some conditions as well as accidental overdose. These are with opioids and these are just counts. So over here we have some data that we pulled from our syndromic surveillance. Our syndromic surveillance lets us look at our emergency department visits. And specifically, we can see if folks are coming in for something that's an opioid related disorder. And then we've done some additional data work on that to identify as best we can what our medication assisted treatment requests. So that can be either initiation or that can be a continuation. So they're missing a dose or their prescription is run out and they're not able to fill it in another way at that time. So this is specifically not Longview, but all of the other emergency departments within the county. You can see we see a big increase of these from 31 all the way up to 359 through 2023. This was a particular interest in that working group to one of our emergency department medical personnel who has been facilitating both peer support and MAT in our emergency departments. So that we can share this out with docs and those who are staffing our emergency departments so that they know that we're having an impact here. And you can see that the accidental overdose deaths with opioids peaking in 2021 have kind of continued to shift down. Again, that 40 number is preliminary. Yeah.
So do we need to make a little note here just for this page? This does not include any data from Longview Acute Center, just to kind of.
Yeah, especially moving forward. I mean, 2023 shouldn't be terribly affected, but 2024 should be, yeah.
So I wonder if we should just make a little note of that, just for helpful, but just curious.
And then finally, just kind of a base setting here. So these will be any opioid overdose emergency department visit by year. What's happening there? So in 2020 and 2021, we don't have the full enrollment of all of our facilities. We have most of our larger facilities, but not all of our facilities enrolled. So those numbers are going to be artificially depressed a little bit. But 2022 and 2023 are. So those overdose numbers, at least the ones that we're seeing in our emergency departments, are pretty stable for the last 2 years. So what we would love to see is, while treatment and harm reduction continue to increase, we'd love to see our overdoses continue to decline and our overdose deaths decline in tandem. And I think that would be a great answer for us. Okay, so in conjunction with some of the population indicators, the Butler Institute has taken responsibility for the initial outreach to grantees in order to understand better what sort of outcomes they're seeking for their grants, what sort of data and processes they already have, and how they're collecting any information, and then use that information to build templates and supports for those grantees to be able to inform their reporting and better kind of characterize the impact that they're having on the opioid epidemic. And then I believe there's a final agenda item about board attendance, and I'll leave that to you all.
Yes.
Any questions for Jared? I want to make sure we're online.
Yeah.
This is important. This is what we've been talking about at several meetings, getting some population data kind of baseline, and then something that we can trend. Is this what everyone was hoping for, expecting? Yes.
So is that the, these, I think there are 4, are these the ones that we're thinking these are a baseline that we're gonna have, like on our dashboard, and then trend over us?
So yeah, absolutely. So these will be involved unless there are tweaks and adjustments to these subsequently. But we also have other ones that we're involving in the broader dashboard. I just pulled 3 for this particular conversation.
Yes, Gordon.
Yeah, well, thank you for this first. This is to answer Tom's question. This is what I was interested in, certainly. But so the first graph, we sort of compared us to Colorado.
Yeah.
On the second 2, do we have that data from other parts of Colorado? Because I'm just trying to think, as we all have this discussion, to try to like tease out, hey, what might we be doing correctly in Lambert County? Or is it some of those things in the other graphs?
Yeah, absolutely. And I'll point out here too, as Tom shared with me, there is a national trend for this as well, which has also turned down, right? So just in this last year in 2023, about halfway through the year, because they monitor that monthly, those deaths with opioids, deaths with fentanyl have both begun to decline. So
Yeah.
hopefully that's a continuing trend. If you go to the next graph real quick. So this particular data comes from this is obviously our coroner's data, so this is one apples to apples comparisons, and that 2023 data comes through CDPHE that usually comes out about middle of the summer. So that'll come out soon, hopefully. That MAT requests come from syndromic surveillance, so that's something that enrolled facilities across the Front Range can theoretically report on. And we've had a conversation, for example, with Pueblo, who's also monitoring their ED data, about sharing our methodology with them to see if we can replicate it in some of these other places. But that's kind of a homegrown methodology. So that's not something that would be shared widely at this point. I will also share that I had a conversation this morning with Civic, which is the all payers database quasi-governmental organization that was established by the legislature 5 or so years ago, that houses all of the insurance claims other than the VA that occur in Colorado. And we had some discussions around exactly that, being able to compare region to region and area to area about some of our substance use and opioid data. So that's something that we're in early conversations with, I would say.
Thank you.
Dr. Olson, this is emergency department data. And we no longer will come on urgent cares.
Mhm.
Lots, and there's also now these pop-up private urgent cares that are run from private companies or not attached to hospital systems. So my wondering is, you probably know where I'm going.
Yep.
Are some of those treating inside the urgent cares, are some sending to the EDs? And do we have any access to that? And I'm wondering a lot of things about that, but especially some, I've been approached by some of these private, smaller groups. Just wondering about that. Do we have any indication or ideas of what's going on in there?
At this point, I don't. It's possible that some folks who are a little more in the field, practitioners do. I will say if it is an insurance claim and this data takes much longer to be able to be available and to check on, it should theoretically be in that Civic all payers data set. Right now, some of the ICD-10 codes associated with addiction, the F1 codes are censored in the data set that we have, but that again is part of that conversation with Civic. In urgent cares are typically not enrolled in syndromic surveillance, except in some other parts of the state where the standalone don't exist to the same extent. So I don't have any insight into that right now. I don't know if anybody else has anything to share on that.
I would say that we've seen a shift in urgent care's prescribing MAT, given the federal shift on the waiver requirements to prescribe. Previously, we didn't get a lot of referrals from urgent cares for that reason. They would just call and say, where can I send this person instead? Now they're asking for consultants and support on prescribes.
Okay, thank you.
Councilmember Black.
Thank you. Doctor, the increase from 2022 to 2023 with the MAT request, does that signify that Larimer County's done its work with destigmatization and getting the public informed that it's okay to ask for help and there is help available? Is that what that's attributed to?
I think that may be part of the story, right? We've also seen in the Civic data set, I've looked and seen, are there prescriptions that are commonly prescribed for MAT for opioids? Are those also increasing? And those are similarly increasing through 2021. So I feel reasonably confident that it's not exclusively a reporting change, right? So EDs being more likely to write down that in the triage notes that there was an MAT request. But that there is some genuine increase in the number of individuals using the ET either for initiation or continuation. I also think there have been some national changes, as MJ alluded to, such as some of the reforms to prescribing behavior. We also know that naloxone and Narcan are more available and available without prescription and through standing orders more so than they were a few years ago. We have our jail facility that is supporting MAT, so there are a lot more avenues to it than maybe existed previously. I would hope that we would continue to see indications, maybe not in the ED, but in other locations of ongoing MAT initiation and support. But we'll have to keep an eye out for this.
Yeah, thank you so much.
All right, thank you, Jared. Yeah, the next one, representation from the ROC. Vice Chair, you asked to take that on.
Yeah, so, you know, we kind of suspended our subcommittee. We might bring it back, we don't know, but all of this group is doing this grantee evaluation. But it's been requested by Butler and also David, our county attorney has also said, that, even though we thought we were going to make policy decisions and stuff, it probably is an open meetings kind of item, and I think Butler did want to make sure, like, if we had 10, I mean, I don't think that'll happen, but if we had an over, more people there from the ROAC and the other, people in the room, it might, have a louder voice, and we want to kind of balance the voices in the room. So we were thinking that maybe we need to, maybe have 2 representatives and maybe an alternative or backup for, and so, well, we had kind of voted that everyone was welcome and available, but I think, David had come back and said maybe it is a open meeting thing, we should be more cautious than not, so I hope that's how I got it all. I think that's what we had talked about, right, Dr.
Yes, I think 2 is the threshold under, you know, at which or under we are,
And then we can have
Exactly.
an alternate, so I would like, to continue, I was there at that meeting, and I'd like to continue, if that would be okay. I'm trying to get my schedule to stay permanently open in that time, so, so I feel like we need to kind of revisit that and vote on that, and I would like to, throw my name as one of those folks and, to be representing, since, and I'm still doing the statewide, data things, and I know AG's office is listening right now, and, they want to say thank you first for the sponsorship, and they're also very curious about this stuff, so.
So is there anybody else that would like to attend the Lerner Epi data working group?
I have an interest, but I also am very interested if there's anyone else. Looks like Brian's hand is up. I don't know if that's indicating
Brian.
interest yet.
Yeah, honestly, I'd very much like to continue on that if at all possible, but certainly I support the council's decision, no matter what happens. So, unfortunately, I could not make last week's meeting. I did have a critical work outage I had to attend to, but that's pretty out of the ordinary, I would say, overall, so.
We
I
have,
would defer to Brian and I could serve as the alternate.
That would be great.
all right, want to make a motion?
I'll make a motion that, this is the council member, Commissioner Chad McNally and Trustee Mason both serve as our primary representatives on the EPI working group, and I can serve as the alternate for them. I'll second that.
Second.
Second.
Great, we got a motion and a second. Any further conversation? Hearing none. Anybody disapprove? Hearing none, that passes unanimously. All right, we do have one more item, and if we come short of time, I don't think we have to make a decision today, but we wanted to kick this off with Carol talking about capital asset policy discussion. I know she's been working with our legal counsel, David, on this, so I'll turn it over to Carol.
Well, can I open it first?
Sure.
So, thank you. So this has started, we were, with Carol and I are kind of, some of the frequent attendees of the regional monthly opioid learning group, which is actually, I think we all can go. It's pretty cool. I would recommend going. But, Jefferson County and I forgot that region, they call themselves G-Rock. They have a name. But they are struggling and we're afraid about investing in capital assets. And so they asked for us to all have this as a conversation, and we were asked to, or I was asked to, and Carol was there to present on this because the Attorney General's office knew that we had done some of this. And so I brought this up, and of course I used the septic system as a capital asset because that was kind of unusual. And so, really everyone, they seem like, hey, we don't know what this is or what we should do. And so, and it seemed like, I feel like, the Attorney General's office was like, well, let's kick this back to the regions to kind of come up with an idea or a solution. So we thought, God, we've really, kind of done this already and feel like, most of the things that we have, like the sheriff's cars, we know where they're gonna be at and be tracked. They're not gonna be sold by us to do something else, but let's just say Harvest Farms, heaven forbid, all of a sudden goes out of business and sells it. Do we get to recover that money? Because that's gonna help with the sale and then it's expanded, right, or something. So, I mean, that's not happening, but there is those thoughts. Like we bought a house for a nonprofit that was gonna have someone living, and then they sold the house and made a profit in town. And it's only been a year, that those are concerns. So, so Carol and Dave Abrams just, I'm taking over the Carol, but that's how it got started. And so we thought, well, maybe we should, see what we can do on our own, so.
Yeah, I think the idea is for the ROAC to decide if we want to have a capital asset policy when we get funding requests for capital assets. And so to define capital assets so that we're all on the same page, basically it's land improvements, buildings, improvements to rental space, equipment over 5,000, and vehicles and trailers of any amount. And the AG's office has said, well, yeah, you can fund capital assets, but they haven't provided any guidance about what's acceptable and what's not. And it sounds like you, first of all, you as a ROAC can decide if you want to fund capital assets in the future, or if you would prefer to just stick with goods and services. So that's kind of the first question is, do you want to do this? And then if you do want to do it, what sort of criteria are you going to use in deciding whether or not it's a good investment of your funds? For example, you know, do you want to only do this with grantees that are government entities, or maybe grantees that are nonprofits that have a history, an operating history? Or, you know, so this is sort of an example of some criteria that you could decide on whether or not you want to use that. And then just scroll down a little bit more. So another question is, are there any capital assets or projects that you won't consider funding? And it would be helpful for you to kind of decide that and maybe share that with people that are coming to do proposals so that they'll know up front. And then also, what sort of provisions do you want in the grant agreements? The grant agreements with the sheriff's office and with Harvest Farms don't say anything about what happens to those capital assets. It doesn't say, you know, if you only use the car for 6 months, we want our money back or anything. It's totally silent. The same with the renovation to the Harvest Farms facility. We don't say anything about that. So here are some things that maybe need to be considered, like who has title, what length of time do you want them to be used for the purposes of the grant? You know, giving Jody's example of, you know, maybe they just sell the facility in 6 months. And do you want them to have insurance and any other sort of special provisions? So those are kind of 3 basic questions, I guess. Maybe there's 4. Do you want to do it at all? If you want to do it, what sort of criteria? Are there any things that you're just like, no, this is not on the table? And if you want to do it, what sort of provisions do you want in your agreements? So that's the intro.
So I'm thinking, Mr. Chair, that, first, I think we should just, I don't know if we should go through all these and maybe everyone needs to kind of marinate on this for a week. But I think we should first just answer the question. Because if we don't answer the first question, then we don't need to do this work at all. So I think if we answer the first question, then let everybody kind of think about these for the next meeting. But if we all decide we don't want to fund capital assets anymore, or have any more of this, then we don't need a policy. So I think if we answer the first question, then we can take a week to, since we're almost out of time. I'm sure everyone would like to maybe think about this because these are a lot of items to consider. And I don't, it'd be nice to know how, you know, our other grant So behavioral health addresses some of this, but I think, we're kind of charting a new territory as well, so.
Yes, trustee Mason.
Yeah, I do think there absolutely needs to be some type of policy. I don't know if that would be maybe simply over the term of the grant period. I think the real question then it happens to be, if one of the grantees is working on, say, for example, building a building, does that term start from potentially when the building is completed rather than over the term of the grant life cycle? So that might be something for the council to consider there. But I do absolutely believe there should be a policy for this. And I would agree that I think it is important for us to fund capital assets as, a lot of the work we've done up to this point does include those types of things.
Do others agree, because we are out of time with trustee Mason? I do. I thank you, trustee Mason. I agree with you. Beth, I saw you shaking your head.
Yeah, I do, and I think, it's a really great question, thank you for bringing it up, and I think it does make sense for us to consider continuing to fund, and I think we do. To work through that, for example, if we fund a different type of supportive housing, do we want to put a restriction deed on it? For those kinds of things, yeah, I think it's important for us to decide those things.
All right, so here's a proposal that the council's amenable to it. We'll take this back and start working on this. We'll marinate on that till the next meeting and put this on the agenda for our June meeting. Does that work? All right.
I have one last
Yes.
question, and this is back to Dr. Gerald Wilson. That's wonderful data. Is that ready for prime time and public, or is this going on the website? Or are we waiting for a little longer before we kind of show the public?
I could edit, I would be more comfortable editing off some of the 2023 data if we were gonna put it out live, simply because that's preliminary and not from
Well,
the
that's
state
cool.
before we have the count.
I
But
think
the initial ones we could do, and I was wondering if maybe we would revisit the allocation pie chart, and then maybe we could roll out all of those shortly together.
Great question.
Correct.
Okay, we're at that time. I do have one item here, and I'll be very quick. At the health department, we have a group of youth that are Youth Action for Health. Well, they created a local campaign to better educate peers about fentanyl and fake pills. They entered the Substance Abuse and Mental Health Services Administration, SAMHSA, Fentanyl Alert Challenge. They called it Fentanyl Effing Kills. Is one of the, and they got honorable mention among nearly 200 entries from across the country. Were awarded $2,000 to actually carry out their program. We can have them here to prevent or online to present it at the next meeting. And a thought to maybe we could match the $2,000, because then what I'm hearing, they could actually really do their campaign. 2,000 kind of gets it going, but I just shared that because that was exciting news that my team gave me. What was that, yesterday? So fun stuff.
Awesome.
It is.
Why can't we have fun committee names like that?
It's not too late.
I know we're out of time, but we would have, since we're only down to $800 left of money to allocate, we'd have to come out, that would have to come out of administrative costs or something.
Yeah, you have to reallocate part of your administrative costs. And I don't know if that, well, I don't know how that fits in that list of approved uses. You have to be kind of careful about that makes, that it matches.
Yeah.
Trustee Young?
That is such great, awesome news. I would be for matching that, although I was wondering where we could come up with that money that would be appropriate to match those funds. But I would be in favor of it, and I am anxious to see their campaign roll out.
Thank you, I appreciate that. Any further conversation or a motion to adjourn?
I'll take that motion. Second.
We got a motion, a second to adjourn. All those in favor? Aye. Great meeting, everyone. The meeting is adjourned. Thank you. Appreciate it.
Thanks, everybody.
Thank you all online. Good to see you.
Thank you, everyone.
Are you aware of the county IT guys are working with criminal justice services.
That was the first, I've heard, yeah, that's cool. Greg or Jared?
So